What is adynamic bone disease? From CKD Dialysis. Imagine your bones as a busy construction site, constantly breaking down and rebuilding to stay strong. In healthy people, this process is balanced, keeping bones resilient. But in chronic kidney disease, especially when on dialysis, this balance can be disrupted, leading to a condition called adynamic bone disease. This is a type of bone disorder that falls under the broader category of mineral and bone problems linked to kidney disease. In chronic kidney disease, the kidneys struggle to regulate minerals like calcium and phosphorus, and hormones such as parathyroid hormone. Parathyroid hormone plays a key role in stimulating bone turnover, which means helping bones rebuild and stay healthy. When kidney function declines, and especially when treatments aim to control high phosphorus and calcium levels, parathyroid hormone levels can become too low. This suppression results in bones that are less active, with fewer cells responsible for building new bone. This state is what we call adynamic bone disease. Because the bones are not rebuilding properly, they become thinner and weaker over time. Even though they might look normal on X-rays, their strength is compromised, making fractures more likely. This low bone turnover can also contribute to calcium buildup in blood vessels, which raises the risk of cardiovascular problems like heart disease and stroke. That's why managing bone health in CKD is so important, not just for preventing fractures but also for protecting your heart. Diagnosing adynamic bone disease is a bit tricky. The most accurate way is through a bone biopsy, where a small piece of bone is examined under a microscope to see how active the bone cells are. Blood tests measuring parathyroid hormone, calcium, and phosphorus can give clues, but they cannot definitively confirm ABD. Imaging tests like X-rays are not sensitive enough to detect these early changes. Managing adynamic bone disease involves carefully balancing minerals and hormones. Doctors might adjust dialysis treatments, such as lowering the calcium concentration in dialysis fluid to prevent oversuppression of parathyroid hormone. They may also review medications like calcium-based phosphate binders and vitamin D analogs, reducing or stopping them if they are contributing to low parathyroid hormone levels. The goal is to restore a healthy balance that encourages normal bone turnover. It's important to remember that each person's situation is unique. Regular blood tests and close monitoring help your healthcare team tailor your treatment plan. If you notice symptoms like bone pain or fractures, tell your doctor. Early detection and proper management can help prevent serious complications. In summary, adynamic bone disease is a low bone turnover condition caused by mineral and hormone imbalances in CKD, often worsened by certain treatments. It increases the risk of fractures and can impact heart health. Diagnosis relies on bone biopsies and blood tests, and treatment focuses on restoring balance through medication adjustments and careful monitoring. Working closely with your healthcare team and staying informed is the best way to protect your bones and overall health when living with chronic kidney disease. Always consult your healthcare provider for personalized advice and care.